All right, as I said, ECG is not given in the blueprint, but in past, there was a feedback where people had seen some simple questions on the ECG. So we're going to talk about a few important stuff, like how ECG changes are related to the physiotherapy. What ECG changes occur when you want to stop the exercises? What are the emergency situations? What are the situations when you don't want to stop, but you want to reduce the intensity of the exercises? Maybe give it a break. Maybe something like you want your patient to take it easy or lower down the speed of the treadmill or anything that you're working with the patient. Okay, so let's try to find how the ECG looks like. Everyone is familiar with this particular diagram here? Let's have answers in the chat. Are you familiar with this picture that I'm showing in the screen right now? Perfect. So P, Q, R, S, T are the terms that you need to know. P means when the atria contracts, QRS means when the ventricle contracts, and ST means when the ventricle relaxes and the atria is getting ready to contract again. Okay, when the atria contracts, you call it atrial depolarization. When the ventricle contracts, you call it ventricle depolarization. And when the ventricle relaxes, you call it ventricle repolarization. What important in the ECG is to understand what changes are most commonly seen with the exercises or with atmospheric changes. Now, when you're working out with the patient, how do you check the endurance of the patient? Anyone in the chat? How do you check the endurance of the patient when you're exercising with the patient? You check the heart rate, right? You palpate the radial pulse or carotid pulse and you check the heart rate of the patient, right? If the heart rate is higher with low intensity exercises, that means the patient's endurance is poor. And when the heart rate is not very high with high intensity exercises, that means the patient's endurance is great, right? Or some of you are talking about 6-minute walk test. That is also something that you want, you can use to check the endurance. But when the patient is working out with you, the first thing that you check on a patient is the heart rate, right? Now, ECG is seen on the telemetry device on a screen where you can see ECG changes. The most common thing that is being shown on the ECG is if the heart rate is rhythmic or arrhythmic. Why are we talking about arrhythmia? Arrhythmia basically means either there's a disruption between the heart rate, whether there are more beats or whether there are less beats, but the rhythm of the heart is broken. Not the heart, basically heartbeat. So imagine if you have somebody that you're testing the heart rate, you're testing how their heart rate is responding to the exercises. Would you keep the finger on the radial pulse for a whole 60 seconds? Or can you also check it for only 20 seconds and then multiply it by 3? You can always check it for 15 or 20 seconds and then multiply it by 4 or 3, whatever suitable to you. The reason is because I'm believing that my patient has a rhythmic heart rate. When a person has a good rhythm, you don't really have to count the heart rate for 60 seconds. You can check it for 20 seconds and multiply it by 3, right? But if you find arrhythmia on the telemetry device, or if you have a patient who have a history of arrhythmia, you do not rely on 20-second rule because there's not a specific rhythm in the heart rate. So you want to check the heart rate for complete 60 seconds. Why are we talking about it? Let's move on to the next slide. Ventricle arrhythmias, PVCs, ectopic beats. You call them ectopic beats. or preventricle contractions. These are unwanted beats. They are not required. But PVCs occurs anyways. The reasons of the PVCs would be if you are stressed, if you are drinking a lot of coffee, if you have certain drugs or medications, if you have a heart disorder, if you have a respiratory disorder. Due to any reason, if there is any unwanted bead, that's called the ectopic or the PVC. Now, imagine if a person who have one PVC in a day, then what? Is it worrisome? Is it something that makes you think, oh, I don't want to work with the patient anymore? No, it's not something that affects your ability in the daily living, right? PVCs could be normal up to a particular stage. If a person has 7 PVCs in a minute, it's a problem. All right? If a person has 4 PVCs in 6 seconds, it's a problem. All right? Which means that the PVCs are occurring too many times. The unwanted beats are occurring too many times, and we don't want that. What happens if there are too many PVCs in a minute? It adds heart rate and it becomes the tachycardia. If the heart rate goes above 100 beats per minute, it's called tachycardia. And we are talking about at rest. Ventricular tachycardia is a condition which is usually caused by the PVCs, and it keeps adding up the number of beats, and at rest, when the heart rate goes beyond 100, it becomes tachycardia. And then the patient goes on medications which reduces the heart rate. But what happens when tachycardia medications stop working, or if there are further complications in tachycardia? It becomes ventricular fibrillation. Ventricular fibrillation is a fatal scenario. A patient can even die if not defibrillated. Or you call it, give electric shock. I don't want to call it electric shock, so call it shock. If you know that every airport, every flight has a defibrillator box, which means if a person has a heart attack, if the patient is going through ventricular fibrillation, you can restart the heart by giving it a shock. Ventricular fibrillation is a situation where the heart rate can go more than 300 beats per minute. And at a time, if a heart is beating more than 300 beats per minute, it will get fatigue and the patient can even die because the heart will stop pumping. Where did everything start from? It starts from the PVCs. So if a PVC is showed up in the ECG, then if it's worrisome or if it's frequent, then you need to talk to the doctor. All right. The types of PVCs. Infrequent versus frequent. Infrequent means that the PVC may be coming once in a day, twice in a day, 5 times in a day, doesn't matter. But the frequent means the number of times PVCs are seen are increasing. Obviously, the frequent PVCs are something that needs to be taken care of. Unifocal versus multifocal, which means you're talking about the direction. When you look at the ECG strip, if the PVC is above the isoelectric line or below the isoelectric line. If it's multifocal, you need to stop the exercise. Are they isolated or they're coupled? If they are coupled, that means two PVCs are coming together or three PVCs are coming together, stop the exercise. If there are more than three PVCs in 6 seconds, then stop the exercise. If there are more than six PVCs in 1 minute, then you stop the exercises. These are the criteria to stop the exercises for PVCs in a patient, which means unwanted beats. Now, if you're wondering how does it look like, you don't have to worry about that because PC is not about identifying the pictures or identifying the PVCs in your exam. But PVC is a pre-ventricle contraction. That means it's the ventricle issue. When there's a ventricle issue, that may become what? So if this is a PVC, you see, if the PVCs are increasing, it's becoming ventricle tachycardia. There's a PVC, there's a PVC, there's a PVC, PVC, PVC. It's increasing the number and it becomes ventricle tachycardia. That's all you need to know. What happens when the PVC comes. And if the ventricle tachycardia is not controlled, it becomes ventricle fibrillation. And as I said, it's the emergency situation. All right. So that was about when to stop the exercises when you see the PVCs. Now let's talk about what happens when the patient has coronary artery disorder, and that leads to either heart's ischemia or infarction. This is the final topic of your ECG. So there are basically two things you need to remember: what happens when there are PVCs and what happens when there is myocardial ischemia versus infarction. Now, out of ischemia and infarction, ischemia is still reversible, which means that if the heart blood supply is regained, the ischemia can be reversed. And infarction is a state where the muscle has died, and it's irreversible. All right. The only way to find out if the patient has myocardial ischemia or infarction is by looking at the ST curve. What you need to remember is if the ST elevates more than 1 millimeter, it's called myocardial infarction. And if the ST depresses more than 2 millimeter, it's called ischemia. So depression goes with ischemia and elevation goes with infarction. All right. All right, let's try to solve some questions. You have about 60 seconds to solve this question. If you are joining it for the first time, always make sure that you're reading the question first instead of starting from the line number 1 up there in your STEM. You want to make sure that what is the goal of the question, what exactly they want you to know. All right, so read the question carefully and then let me know what your answer is. I'm going to give you 30 more seconds and I'm going to be mute and off screen. All right, let's read the question together. It says, monitoring the ECG response of 52-year-old patient performing Bruce protocol on an inclined treadmill. In which of the following scenarios will the therapist be least likely to stop the exercise? Least likely to stop the exercise. 5 PVCs in 1 minute, 4 PVCs in 6 seconds, heart rate reduced while exercising, or couplets frequently. As we discussed before, couplets means stop the exercise. Heart rate is supposed to increase with the exercises, but when it reduces, that means something is not right with the patient. Unless if the patient has taken certain medication that is supposed to reduce the heart rate, but that's a different story. We don't know what medication the patient has taken in this particular question, so we can't assume it. Physiologically, the heart rate is supposed to increase, but if it's reducing, then there's a problem. 4 PVCs in 1 second, stop the exercises, and 5 PVCs in 1 minute. You may not want to, no need to stop, because the criteria is more than 6 PVCs in 1 minute. That's why option A is your correct answer. So this question is mostly with the least likely. So if you would have read the question first, your brain would have gained that information that this question is not about what is the reason to stop the exercise, but is about what is not the reason to stop the exercise. All right, I have another question on the ECG. Let's try to do it quickly. About 1 minute to solve this question. I'll be off screen and I'll be on the mute. All right. So second question says, while walking the patient, therapist noticed the ST segment rises 1.5 millimeter above the isoelectric line. What would be the best decision at that moment? A 60 years old male patient undergoing cardiac rehabilitation post MI in the hospital. On day 3, the patient has progressed to walking. The patient has been kept on regular treatment for the coronary artery disorder through beta blockers and calcium channel blockers to control the heart rate and maintain the dilation in the arteries. Now you see the tone of this question. If you read the stem of the question, you'll be like, I never studied about beta blockers. I never studied about calcium channel blockers. How do I know what to answer this question? And you may feel like this is out of syllabus. How can Capper do it with me, giving me the questions on the drugs and expecting me to answer something that they don't want us to study? But the real question here is, if the patient's ST segment has risen up to 1.5 millimeter above the isoelectric line. When you're given this information, whatever given up there would not impact that information. This is not just the rule for this particular question. You may experience this kind of situation many times in your exam. Like, why are they talking about the stuff that is not even covered in the syllabus, not even covered in the blueprint? The solution to that problem is read the question and try to connect with what you have studied in your textbooks or during your course. So if the ST segment is more than 1.5, that means there is myocardial infarction. And in any case where you already know that there's a myocardial infarction, you do not exercise the patient and call 911. It's a 911 situation when you know that the patient is into the category of the myocardial infarction. So option B is going to be the correct answer. You don't just want to reduce the intensity, you want to call 911 because this is something very serious. And if it's not stopped on time, the patient can even die. All right, stopping the treatment for the day, option D, is not right because you already know what's going on with the patient. And according to you, it's just like a situation where you did Brudzinski's test. Do you remember what Brudzinski's test is for? Or Kernigh's sign? Or Lamrecht sign? The upper motor neuron lesion, or meningitis? Would you wait for any specific instructions from anyone if there is meningitis? You wouldn't. You call 911. And that's the same situation. It's an emergency situation. You're going to call the 911. All right.